Dr. Scott Fuller here, March 24th, your good news doctor, pulling out some good information, some hopeful information out of all the news that's coming at us so hard. This was on PBS Newshour last night on March 23rd. Judy Woodruff was interviewing Atul Gawande. They were talking about the different hospitals around the world making differences. First, understand that what we're seeing in Italy is that the hospitals themselves became sources of infection. But contrast, Hong Kong and Singapore, they were able to control the infections very effectively. They had a playbook and it worked. Here's a little bit of the playbook. They started by saying, if you come to work, we're going to test you, and if you're sick, you're going home. Secondly, number two, everyone wore a surgical mask, and when they came into work and kept it on all day, partly for protection of the healthcare worker, but of course, spreading inside and outside hospitals. Third, they separated respiratory patients from non-respiratory and different teams, different lines of treatments and so forth. So a little bit about coronavirus, Atul Gawande is talking about. Of course, they had to clean between patients. But second, one of the most interesting things, it shows that you don't have to be totally draconian with your community efforts. In Singapore, for example, when you had, you didn't automatically quarantine everybody that was exposed. They only sent you home to be in quarantine if you were within 6 feet of the patient for more than 30 minutes without a mask on. And that was effective. That was effective. What it tells you, a brief momentary exposure within 6 feet to someone who has coronavirus, that you don't necessarily have to fear that you're going to be causing the same spread. The duration of exposure was depending on how close you were, and of course, hand washing if you do have possibility of secretions. That was one article. Here's the other one that was just today on Here and Now on NPR, March 24th. Jason Beaubien, who's the NPR Global Health and Development correspondent, was talking about Hong Kong, Singapore, and South Korea. These governments had not had to shut everything down, and these countries are doing very well with controlling the virus. Hong Kong, by the way, has 7 million people, and those people are more densely packed than even LA. How did they do it? Lots of testing, restricted travel, quarantining of people that had exposed, and they jumped on it aggressively. If somebody tested positive, they tracked down all of the contacts very carefully and quarantining everybody very, very fast. The recent surges on any of those locations, Hong Kong, Singapore, and South Korea, is not from community spread now is what they're talking about. It's actually from returning travelers, people actually bringing it back in. South Korea, same thing, testing, data, and quarantine. But keep in mind, these companies, for the most part, stayed open in South Korea. Japan is keeping the curve flat. And Singapore even was able to keep their schools open. So that's hope from us. And what I'm hoping, too, is with what President Trump is saying today, is maybe we won't continue to shut down the communities. My thought is sure, let's keep the quarantining and the isolation and so forth and the contacts down of nursing homes, vulnerable populations, and the chronically ill. Keep that very tight. Keep those policies in force. Let's listen to our public health experts and doctors, but maybe not necessarily shut down the entire country and all of the ramifications that could be for the next several years or lifetime. We want to avoid recession, depression, millions losing jobs, businesses closing. Maybe we don't have to do that. The other countries are showing us it's possible. It's possible. If we have a brief shutdown like President Trump is saying, and at the end of 15 days, we start to reinstitute the economy, but again, watching the vulnerable populations in the nursing homes and the hospitals and helping the hospitals with whatever they need, good stuff. Remember, your best defense is keeping your immune system strong of you and your family. And that list is sevenfold. Number one, the cleanest diet you possibly can. With your kids stuck at home, bring them into the kitchen. Start preparing meals together. Number two, exercise. Start moving your bodies. Get your kids involved. If you're working from home now, take 3 breaks during the day. Every 2 hours, take a 15-minute walk outside. Number three, take care of your spine and nervous system and go to your chiropractor. Chiropractic is essential care, not because we treat these things directly, but we help improve the health of the host. That's what chiropractic does for people. Number four, keep your water intake high. Make sure that that's every day, daily. Watch that. Number 5, decrease your stress. Release chemicals that make you feel good. How do you do that? Go help somebody. As soon as you help somebody, you release those chemicals, the oxytocin, the serotonin that make you feel awesome. Number 6, the immune system supplements, the fish oil, vitamin C, vitamin D, zinc, magnesium, and so forth. And number 7, institute your other treatments when they become available to you. Obviously, things are closed right now, but the acupuncture and the massage, the meditation, the mindfulness, get back to the physical therapist, take care of your joint problems, and so forth. I'm Dr. Scott Fuller. Good night. Thank you.